What are some of the big, subjective things that you guys are looking at for a testicular cancer patient or survivor?
Yeah, so a lot of it complements the hard outcomes as well. But I think the focus and the reason why we want to do a lot of this is because traditionally outcomes have kind of been documented by physicians in the office. And part of the problem with that, and this is certainly something that was learned about in prostate cancer and other cancers as well, is that what a doctor hears from their patient and what they put down in the note or whatever might be very different from what the patient is actually experiencing. For better or for worse, patients they want to have good outcomes. They want to kind of please their doctor, which is, something that's inherent to, I think, the human condition. So you may downplay certain aspects of things. You may tell someone, "Oh, it's not so bad." Meanwhile, the ache or the pain or the mental concern is actually quite debilitating. But you don't want to feel like you're burdening your doctor, and that should never be the case, obviously. So, what the benefit of doing this is that patients are able to fill this out or complete these survey instruments in the privacy of their own home or in the office. And it's not something that is told directly to the physician. It's something that you can kind of, put down in privacy. And hopefully people can be very honest about that, because I do think that, it's important to really get things from the patient perspective in that regard. But to directly answer your question, things like body image, things like fear of recurrence, which is very difficult thing to kind of quantify, and certainly for some people, very difficult to kind of verbalize. Other components of the survey instrument that we use here at MSK, which is an adapted version of the EORTC TC26, which is a testis cancer specific survey, ask about, interpersonal relationships with your partner, concerns about fertility. You can certainly study fertility by getting a semen analysis in patients, but that doesn't necessarily, query whether someone's worried about it or not. These are things that, although you may have a totally normal semen analysis, you may still actually have a very significant fear of fertility concerns later in life because you've received chemotherapy, or even because you've got a diagnosis of testicular cancer. Plenty of my patients worry, well, how is this going to affect my children if I bring them into this world, or if they exist already, do I have to tell my son, dad had testis cancer? I mean, your book is, an incredible testament to that having these conversations is quite difficult, and all of this stuff weighs on patients constantly. So these are the kinds of things, and that's certainly not a totally exhaustive list, but these are the kinds of things that are very difficult to kind of quantify and collect just by, getting lab tests or CAT scans and stuff like that. Other things are related to neuropathies, hair loss. I think I already mentioned body image concerns from, having a unilateral or a bilateral orchiectomy with or without prosthesis. Satisfaction with the prosthesis, which I think is a pretty understudied thing. The internet and the forums on the internet are filled with discussions among patients to try to elicit information about, hey, what's been your experience like? And, those are largely anecdotes, and the people responding may be biased. People who are not happy with it may be more likely to chime in and say, listen, this is not great. It hurts. It's not really where I want it to be. Whereas those that are happy with it may never, kind of balance that discussion. So by collecting these data, we're going to be able to report it with a very large group of patients, a very heterogeneous group of patients that have a number of different experiences. And, as the numbers grow, it will represent a more kind of real world, very enriched sample of people that can give a very wide range of experiences. But from that, you're able to kind of get the normal, the average, what are the things that I can potentially expect? Like, what's the range of satisfaction or dissatisfaction? Because if 95% of people are quite happy with their prostheses, then obviously, dissatisfaction afterwards is going to be rare. And it would be great to be able to tell people that, because I think it would encourage and inform their decision making, because right now they have to, just kind of talk to other people, and that's fine. It's super helpful. I think the internet forums and, survivor groups and, foundations and awareness organizations do an incredible job of helping patients with all of that. But being able to really, study it and collect it systematically and be able to, give people this information to inform their decisions, I think is really important.